Well, good morning. Thank you for being with us. We are going to do something a little bit different over the next couple of days. Over the next 3 days, we'll be holding a series of Facebook live streams featuring local experts and professionals from here in the area on mental and emotional well-being of populations here in this area during the pandemic. Now, during this morning's live update, Bob Lutz with the Spokane Regional Health District will be giving a daily update. He'll also be joined by Lynn Kimball. She's the Executive Director of Aging and Long-Term Care of Eastern Washington. And we'll also be joined by Commissioner Josh Kearns to give an update from Spokane County. Now, Lynn Kimball will be specifically this morning focusing on older adults and those supporting them during the COVID-19 pandemic, some of the safe activities you can do at home to promote both physical and emotional well-being. And also we'll be discussing resources which will be available to help older adults stay connected. And of course, if you have any questions at all, please feel free to share them with us on Facebook. And following our discussion here this morning with our two speakers, Spokane County Commissioner Josh Kearns will also have an important announcement for Spokane County residents. But first, we will start with Dr. Bob Lutz.
Well, good morning. We're 2.5 weeks, almost 3 weeks into our local outbreak. Our first cases were identified on March the 14th, and as of today, we unfortunately have had 158 individuals who have been identified, and I say tentatively identified, with COVID-19. I say tentative because we are still awaiting confirmation from Department of Health. But again, that's 158 individuals who have been tentatively identified with COVID-19, and unfortunately 5 individuals have died of this illness. With respect to the screening site, it will unfortunately still remain closed today. We have found a new site for it, however, at the fairgrounds. This site will be much better suited for inclement weather, as we've been experiencing the last few days, and we hope to have the new site up and running by about 10 a.m. tomorrow, Thursday. As was introduced, we're looking at a little difference in our approaches to these live streams, and we're going to be talking about mental health, and today specifically looking at senior well-being. I think it's important for us to really focus on this population because unfortunately, as we have seen, older individuals are disproportionately impacted and affected by COVID-19, not only by the disease itself, but also by the social distancing that oftentimes occurs when individuals are again being asked to stay at home. We talk about the importance of social distancing, but not social isolation. But we also talk about the importance of social distancing with your immediate family groups. And for seniors who oftentimes have children, have grandchildren that are so important in their lives, not being able to see them in person, but maybe having to connect with them virtually is a challenge. And so that's why I think it's essential that we really focus on this group first and how we can address their needs, both physical as well as emotional and mental. So I think with that, I'm going to turn it over to Lynn Kimball.
Thank you so much and good morning. Aging and long-term care has gone through many changes in the past few weeks. Like other community agencies, our staff is still working, and we're here to serve and support older adults and people with disabilities in our community in what has become the very important task of staying home. Our senior helpline continues to operate, so know that if you need help connecting to support or finding local resources, give us a call at 960-7281. I'm here to talk to you about what you can be doing to best get through these times, how to stay connected while staying in place, what family members need to watch for, and what resources in the community are here to support you. But first, let's talk about social distancing, which is key to protect both yourself and others. Stay at home as much as possible. Don't go out if you're sick. Stay home and contact your healthcare provider if you're concerned about your symptoms or if they're worsening. If you do go out in public for essential grocery, pharmacy, or medical services, be sure to keep 6 feet of distance between yourself and others. Wash your hands often, use hand sanitizer if you have it, and don't touch your face. Please use senior shopping hours whenever possible. They are there for you, and we thank our local grocery stores that have organized these hours so that you can safely go grocery shop. Also, consider ways of getting food or prescriptions delivered to your home using friends, family, grocery delivery services, and community support networks. Be sure to stay in touch with others. You may need to ask for help from friends, family, or neighbors, or even community health workers if you become ill. So make a plan now, so if you do become ill, you'll know who to call for support. So you're staying home. What can you do to stay well while you're at home? First, be sure to create and follow a regular routine. That structure is so critical to making sure we stay well at these times. Stay physically active, go for a walk, stretch, do exercises at home, dust off those VHSs and DVDs we all know we have. Do some activity to keep yourself moving. Check in with your friends and family regularly. Stay connected by writing letters, calling, or sending emails. Use technology to help you stay connected. Zoom, Facebook, FaceTime, Skype, WhatsApp. These are just a few resources that can help give you an opportunity to see each other face to face without ever leaving your home. Please use it. Find ways to laugh. Do things you can do safely at home that you enjoy, like gardening, reading, knitting, singing, playing music. It's a great time to explore a hobby to stay well. Take care of your body. Try to eat healthy, well-balanced meals, get plenty of sleep, and avoid alcohol and drugs. Take breaks from watching, reading, or listening to news stories if it's upsetting. It can get overwhelming at times, so take breaks when you need to keep yourself mentally well. Take deep breaths, meditate, pray, whatever helps you reduce stress, please do it. Connect with others and talk with people you trust about your concerns and how you're feeling. And most importantly, if you or someone you care about are feeling overwhelmed with emotions like sadness, depression, or anxiety, or feel like you want to harm yourself or others, please reach out for help. Help is available. If you're caring for a loved one who's an older adult, what are some of the signs of stress that you should look for, and what can you do to help them and help support them? So first of all, some of the signs of stress you will want to look for are fear and worry about your own health or the health of your loved ones, changes in sleep or eating patterns, worsening of chronic health problems, increased use of alcohol, tobacco, or other drugs, changes in mood, greater irritability, anxiety, sadness, or indifference, difficulties with short-term memory or concentration, or low energy and fatigue. What are some of the things you can do to help support older adults with minimizing stress? So first, check in regularly. If there is an older adult in your life and you're concerned, check in with them, give them a call, pull out FaceTime, check in, and see how they are doing. When you're talking, keep news updates to a minimum and get your information from credible sources so you have accurate information. Stay calm and be sure to repeat positive stories. As much as we can focus on the positive at this time, that helps a lot with stress and anxiety. And look for ways you can help support older adults safely. And then if you need help, please reach out for support when you need it. These can be tough times, but we will get through them together. Staff at Aging and Long-Term Care are here to support you. If you have questions for yourself or your friends about local resources, call our senior helpline at 960-7281. Our staff is there to answer your questions and has up-to-date information on local resources to connect you to groceries, home-delivered meals, transportation, benefit assistance, questions about Medicare, and much, much more. We are there to help, and we are standing by to help you. This week, we did launch a new service called Senior Reassurance Calls. If you want someone to check in with you and have a scheduled call, please contact us again at 960-7281 or email us at action@altcew.org. Our staff, along with students from WSU College of Nursing, are doing calls to check on people's well-being, connect them to resources, and reduce isolation. So if you're alone and you don't have support, or even if you want to talk to someone else, please give us a call, get on our list, and you can get a regular call to check in and just have a chat. If you're caregiving, being a good daughter, son, husband, wife, or neighbor, and you're helping an older adult with shopping, support, or personal care, we're also here to support you. So call our helpline at 960-7281 to be connected to caregiver support, which provides resources to help support you as the caregiver in staying well. Paid caregivers that work independently and through home care agencies are still out providing care in the community as essential services. If you have a case manager and you have concerns about your care, please reach out to your case manager at Aging and Long-Term Care or at Frontier Behavioral Health Elder Services. Case managers continue to work to support you in staying at home. Thank you to all the caregivers that are helping people stay safe at home. We greatly appreciate you and all that you are doing to keep people safe. Thank you. I also want to say thank you to our partner agencies, local businesses who've changed their operations to protect older adults, and all those who continue to work as essential services. Thank you to all of the community members that are making the choice right now and the right choice to stay at home. Your choice makes a huge difference in the lives of others and the people we serve. And also, thank you to our state, federal, and local government partners that are all working together so we can beat this. We are in this together and know that we are here to support you. Stay inland strong. Thank you.
Lynn, I have a question if you'd like to stay
sure.
up there.
Yeah.
We have a question from a viewer wanting to know, it's not only caregivers caring for some older adults, but neighbors.
Yes.
We want to make sure neighbors are looking after neighbors as well. What are some suggestions? We're looking after maybe some of older adults that may be in your neighborhood, next door neighbors down the street.
Yeah, it's so important. If you have neighbors that are older adults, check in with them. If you have phone numbers, thanks to Neighborhood Watch, or just from knowing each other, check in and see how they're doing. See if they need help with groceries. Can you go on a grocery run? Can you go pick up prescriptions? Take a look and ask them what you can do to help support them at this time. That check-in itself is so important. So please check in on your friends and neighbors, because you don't know if someone has someone else who's there to see how they're doing.
And we have another question wanting to know, it's not only the older adults, but it's the caregivers, like you said earlier, you touched on this. How important is keeping track of your health, your well-being, not only for yourself, but also for the folks that you could be looking after or keeping an eye on?
Yeah, as a caregiver, it can be really stressful, and especially at these times when you yourself are probably feeling some anxiety about all the events going on. So definitely reach out for help and support. Look for things you can do as well to keep yourself balanced in these times. So make sure you are also taking time for yourself, spending time with mindfulness, breathing, taking breaks where you need them. So definitely reach out for help as well. We do have our senior helpline, can connect you to support services that can give you everything from support from a listening ear, someone to listen and hear your concerns, to actual suggestions and resources that are going to help you. All right. Thank you.
Hello, I'm your Spokane County Commissioner Josh Kearns, and I wanted to give you an update on the latest info from your county government. To comply with the governor's orders, we now have over 600 county employees that are telecommuting, not only for their safety, but for the safety of you, our constituents who we serve. But we are still providing the level of service that you deserve and have come to expect. We are becoming more innovative and efficient in the way that we deliver our services. For those of you who still would like to deliver your property tax payments in person, we've installed a drop box right out in front of the county courthouse for your convenience and safety. We also are still encouraging people to still please visit the Spokane County website. We are still open for business, just not business as usual. On our Spokane County website, which is spokanecounty.org, you will find a directory of phone numbers for all of our departments. Many of our departments now have new hours of operation and different guidelines on the way that they are conducting business within those departments. So please, I encourage you, visit SpokaneCounty.org. You will find on there just a countless amount of services that are still available on there. And save yourself a trip to the courthouse. Just give us a call or visit us online. We can help you out on there and deliver those services that you need. As your commissioner, to comply with the governor's orders as well, I am no longer able to attend in-person meetings with my fellow commissioners to recognize that social distancing and safety. Now all of our open public meetings must be conducted either telephonically or through a web-based meeting platform, but we still have an option now for those of you in the public that would like to stay up to date with the most recent information. You can call in and listen on the telephone to everything that we are discussing and voting on. And again, you can get that information again at spokanecounty.org. Two things I wanted to highlight of items that we've taken action on at the county this week. Earlier this week, our Spokane County Treasurer Michael Baumgardner pushed back the due date for property taxes by 45 days. So that moves the deadline from April 30th to June 15th to help those that are struggling in our community. And secondly, I'd like to make an announcement today of some action that was taken yesterday by the Board of County Commissioners. We voted unanimously yesterday at our public meeting, on our web-based meeting platform. We voted unanimously to suspend all late fees, penalties, and interest charges on all unpaid sewer bills and solid waste for the next 3 months. We have an amazing community here in Spokane County, and it is an absolute honor to serve you. When we get through this, we will be a stronger and healthier community than ever. We are Inland Strong. Thank you.
Commissioner,
Yes.
One of the questions that we've received is with the confusion over what is and is not an essential business. Could you describe what the county is doing when it comes to things like roads? How is our Public Works Department addressing keeping those roads safe and maintained during this crisis?
Yes. The question is how we are essentially how we are operating with public works and roads. Spokane County right now, we have the largest network of lane miles in the state. We have over 5,000 lane miles of road that we maintain, whether that's grading, whether that's patching potholes, sealing cracks, or repaving. We're still operating operating. We have adjusted some shifts to allow for social distancing and safety measures, not only for our employees but for the public as well. But we're still out there performing those duties. That's a very important essential job or function of county government, and we are still out there. So I want to encourage folks, if you have a road issue, if you see those large potholes that can be a danger to the public, for those that are out there, please report those as always by reaching out to our public works. But we are still open for business when it comes to our roads. Thank you.
The next question we have is for Dr. Lutz. So Dr. Lutz, one of the questions that we're getting the most here on our Facebook Live is about masks. There's a lot of conversation about masks going around in the community right now. In your opinion, should the general community, when they are going out to access these essential services, should they use masks? And if so, is there any guidance on the type of mask that the public should be using, whether it's a bandana, dust mask, etc.? What is your guidance on that?
Yeah, there's been a lot of questions around masks for weeks, not only from the standpoint of who should be using them, but what type of mask should be used. If you look at guidelines right now from both the World Health Organization and the CDC, they have been pretty consistent in not recommending general use of masks for individuals to prevent illness. Now, you may be aware of the fact that the CDC has been asked by the Surgeon General to review those guidelines and recommendations, especially in light of the fact that we know that asymptomatic spread can occur. That means that individuals who are essentially without any symptoms may actually be able to spread the infection. And so I think it's prudent to look at those guidelines to see if whether or not general use of masks is appropriate in settings where people may be interacting with others, especially in settings such as going to grocery stores. If you look at other cultures, it's very common practice to wear masks. They wear masks not only to protect themselves, but also to protect others. And we know that asymptomatic spread occurs. At some level, we call this what's called source control. If I have infection, if I'm able to put a mask on, I can prevent others from getting infected. And so again, I think at this point, I would like to say that the guidance is evolving. It can't hurt. It can't hurt fundamentally to wear a mask if you are out in the public. And if you're going to wear a mask right now, my concerns are that I need to ensure that I have appropriate masking for healthcare workers and others who are going to be on the front lines taking care of everybody who's sick. If you have access to masks, the general purpose surgical masks are adequate for source control.
We have one question, or actually a couple of questions, wondering about the screening site and when it will be back open.
Sure. The last couple of days with the inclement weather have proved to be anything but good for the outdoor screening site. And as you may have heard, the winds a couple of days ago actually took down the tents. So we've identified a new site at the fairgrounds. It is enclosed, and so we won't have to worry about the fickleness of our spring weather. And we hope to have that site up and running as early as 10 a.m. this Thursday. Okay. So with that, I will bid you a fond goodbye and ask you to check in tomorrow morning at 10 o'clock.